Every year, thousands of seniors lose money on Medicare simply because they don't understand how it works. The average person overpays by $2,500 per year. That's money you've earned and deserve to keep. Today, I'm going to show you the 5 biggest Medicare mistakes and exactly how to avoid them. Medicare can be confusing. There are parts A, B, C, D, supplements, advantage plans, and enrollment windows. It's easy to make costly mistakes, but by the end of this video, you'll know exactly what to watch out for. Mistake number 1, missing your initial enrollment period. When you turn 65, you have a 7-month window to enroll in Medicare. It starts 3 months before your birthday month, includes your birthday month, and extends 3 months after. If you miss this window and you're not covered by other insurance, you'll face late enrollment penalties that last for the rest of your life. Here's what happened to James from Texas. He turned 65 in March, but didn't think he needed to enroll right away because he felt healthy. He waited until September to sign up. Because he missed his initial enrollment period, he now pays a 10% penalty on his Part B premium every single month. That's an extra $17 per month, or over $200 per year for the rest of his life. Over 20 years, that's more than $4,000 in unnecessary payments. Here's what you should do. Mark your calendar 3 months before you turn 65. Even if you're still working and have employer coverage, check if you need to enroll or if you qualify for a special enrollment period. If you have questions, call Medicare directly or speak with a licensed insurance agent. Don't wait until the last minute. The penalty for missing your window follows you forever. Mistake number 2, not understanding the difference between Medicare Advantage and Original Medicare. Original Medicare is Parts A and B administered by the government. Medicare Advantage, also called Part C, is run by private insurance companies. They're very different, and choosing the wrong one can cost you thousands. Sarah from California chose a Medicare Advantage plan because the monthly premium was $0. That sounded great. But when she needed hip surgery, she discovered her plan had a $7,000 out-of-pocket maximum. Her doctors weren't all in network, so she had to pay more. She also needed prior authorization for many services, which delayed her treatment. If she had chosen Original Medicare with a supplement plan, her out-of-pocket costs would have been much lower. Here's what you need to know. Medicare Advantage plans often have low or zero premiums, but they usually have higher out-of-pocket costs when you actually use healthcare. They also restrict you to network doctors and require referrals and prior authorizations. Original Medicare with a Medigap supplement has higher monthly premiums but much lower costs when you need care. You can see any doctor who accepts Medicare nationwide. Think about your health needs and how often you see doctors before choosing. Mistake number 3, not reviewing your plan. Every year during open enrollment, Medicare plans change every year. Your costs, coverage, and which drugs are covered can all change. Many people just keep the same plan year after year without checking if it's still the best option. Robert from Florida stayed with his Medicare Advantage plan for 5 years without reviewing it. Then his primary care doctor left the network. His plan also stopped covering one of his medications. He didn't find out until he went to pick up his prescription, and the cost had jumped from $10 to $380 per month. If he had reviewed his plan during open enrollment, he could have switched to a plan that covered his doctor and his medication. Here's what you should do. Every fall during open enrollment, which runs from October 15 to December 7th, review your current plan. Check if your doctors are still in network. Make sure your medications are still covered. Compare your plan to other options available in your area. Even if you have Original Medicare, review your Part D drug plan and your supplement. Plans change and so do your needs. Spending an hour each year reviewing your coverage can save you thousands. Mistake number 4, forgetting about Part D prescription drug coverage. If you have Original Medicare and don't enroll in a Part D drug plan when you're first eligible, you'll face a late enrollment penalty. Even if you don't take any medications now, you should still enroll to avoid the penalty. Linda from Ohio didn't take any prescription drugs when she turned 65, so she skipped Part D coverage. 3 years later, she was diagnosed with diabetes and needed medications. When she tried to enroll in Part D, she discovered she owed a penalty of 1% of the national base premium for every month she went without coverage. That's about $9 per month in penalties, for as long as she has Medicare. Over her lifetime, that could be $3,000 or more in unnecessary costs. Here's the truth. Even if you're healthy now, enroll in Part D during your initial enrollment period. You can choose an inexpensive plan with basic coverage if you don't need prescriptions yet. This protects you from penalties if your health changes later. If you do take medications, make sure your Part D plan actually covers them. Not all plans cover all drugs, and formularies change every year. Mistake number 5, not understanding what Medicare doesn't cover. Many people think Medicare covers everything. It doesn't. Medicare doesn't cover dental, vision, or hearing. It doesn't cover long-term care in nursing homes. It doesn't cover care outside the United States. Not knowing these gaps can lead to huge unexpected bills. Margaret from Arizona thought Medicare would cover her long-term care when she could no longer live independently. She ended up in a nursing home and was shocked when Medicare stopped paying after 100 days. She had to spend down her savings to $2,000 before Medicaid would help. She lost almost $80,000 of her retirement savings because she didn't plan for long-term care. Here's what you should know. Medicare covers skilled nursing care for up to 100 days after a hospital stay, but it doesn't cover custodial care in nursing homes. If you need help with daily activities like bathing and eating, that's not covered. Consider long-term care insurance or other planning strategies while you're still healthy. For dental, vision, and hearing, you'll need separate insurance or pay out of pocket. Some Medicare Advantage plans include these benefits, but read the fine print carefully. Now you know the 5 biggest Medicare mistakes. Don't let confusion cost you thousands. Review your options carefully, ask questions, and make informed decisions. If you need help, work with a licensed insurance agent who specializes in Medicare. Your future self will thank you for taking the time to understand your coverage today.